Okay, here's my audience. My name is Bailey Carson, and I'm going to be speaking about fibromyalgia. What is this condition? William Oscar said, "Medicine is a science of uncertainty and an art of probability." There are anywhere from 10 to 15 million physicians in the entire world, according to Quora.com. That number does not include the medical students. There is still no known cure for a common disease that you have probably all heard of, fibromyalgia. Have you ever been in the hospital with some type of medical problem where there's just no cure or solution? If so, you may know how that feels. People with fibromyalgia feel that way. If you aren't already aware, you may be wondering, what is fibromyalgia? Fibromyalgia, or fibritis, is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues, according to the Mayo Clinic. This is the muscular system right here. As you can tell, it is the whole body. So with somebody that has fibromyalgia, their whole body constantly is hurting. Symptoms sometimes begin after some type of physical trauma, a surgery, maybe an infection, or even a significant psychological stress. Some people will get this disease and it gradually accumulates over time. It builds up. It doesn't end for them. Did you know that women are more likely to develop fibromyalgia? There's about 50% more women with fibromyalgia than men. Many people who have fibromyalgia also have tension headaches, joint disorders, irritable bowel syndrome, anxiety, and depression. As I stated earlier, there's still no cure. People are working on it, but there's just no cure yet. There are various medications that can offset some of the symptoms, such as a selective serotonin. That would be used to ease symptoms of depression and anxiety, things like that. Tylenol, ibuprofen can be used, for muscle aches, things like that. Anti-inflammatories such as naproxen, nerve pain medication, and muscle relaxants are also used. People with fibromyalgia usually see psychologists, psychiatrists. They go to rehab doctors, physical therapists, occupational therapists, and they are usually seen for support and pain management. The medical field is a continuously growing field. Clinical trials are a huge part of this. A clinical trial is where a hospital or a medical company will perform prospective treatment plans on actual humans at no cost. It is completely free to those who qualify. The Novak's Clinical Research Center is seeking volunteers as we speak. They are trying an investigational medicine for fibromyalgia pain. People who do clinical trials, they sign this paper. They know that it'll either go really good or it's going to go really bad. They just take that risk. I think that if companies like Novak's Clinical Research keep it up, then there will be some type of cure or an offset in no time. I currently work at AnMed Health on the surgical unit floor as a patient care technician. And something new that we are trying and has been tried in various different countries for pain management are aromatherapy with essential oils. People in France and Spain, they do this as an opioid alternative. So in America, we have a huge opioid epidemic. This is where people in South Carolina, this is the highest state. So we're going to bring in these aromatherapy essential oils. They will go on a cotton ball in a small medicine cup. There'll be maybe 4 drops on it, and the patient will hold this cup like 4 to 6 inches away from their face, take deep breaths for 5 minutes. This is called olfaction, and it's where you inhale, and it's the fastest way that this can go to your brain and ease your pain. This is projected to have a positive toll on healthcare. In conclusion, although fibromyalgia does not yet have a cure, one will be found. Could this relief possibly come from some sort of vaccine or even, essential oils? If medical professionals keep working, we can find out soon. And here's my comments.